I am a physician, staff physician, and physician scientist at Cleveland Clinic with a primary appointment in the Cleveland Clinic Cancer Institute. Uh, I, um, I see primarily patients with hematologic disorders, bleeding, clotting, autoimmune disorders, etc. Yeah, well, in terms of hematologic disorders, especially if you go into the malignant hematology realm, there's a lot of patients with leukemia who are getting leukemia chemotherapy, getting bone marrow transplants, things like that often may need blood transfusions because of anemia related to their disease, but temporarily worsened by their therapy. There's patients with something we call myelodysplastic syndrome that are patients who have a syndrome where their bone marrow does not work properly and does not make enough red blood cells and oftentimes other types of blood cells as well. There's patients with immune-related disorders, aplastic anemias whose bone marrow also stops working, that may need support with red blood cells. Sickle cell disease, obviously, is another disorder when patients who get hemolysis, which is destruction of red blood cells, which occurs a lot in sickle cell disease, and they can also go into crises where, for one reason or another, the rate of hemolysis, the rate of red blood cell destruction is increased. Their levels of red blood cells can fall quite quickly and quite severely, so they may need support with red blood cells. There's other kinds of hemolytic anemias. There's something called autoimmune hemolytic anemia that can be due to different types of autoimmune antibodies. They can need red blood cell transfusions. There's patients with chronic bleeding disorders. One is called hereditary hemorrhagic telangiectasia, or HHT, who may have chronic nosebleeds, chronic GI bleeds. Oftentimes they can be treated simply with iron, but may need red blood cell transfusions as well. So there's really a whole panoply of disorders, and that doesn't even get into the realm of surgery, particularly cardiothoracic surgery, where patients need red blood cell transfusions to support them through surgery. So there's really a really large need across the medical spectrum, including hematology, who require red blood cells. Yeah, I think that every time a clinician gives a red blood cell transfusion, they always say, do we need to do this? Does the patient need this? Because we don't like to give more transfusions than we have to. There's a number of reasons for that. Probably, every time you give a red blood cell unit, there's potentially a risk of transmitting infection, although the Red Cross does a tremendous job of making sure our blood supply is safe. But also in some cases, patients can develop what we call alloimmunization. In other words, the Red Cross and the blood bank here, transfusion service, can type all red blood cells have different, we call them antigens, which are types of proteins on the surface of the red blood cell. And we can measure the most important ones and make sure that the blood is matched. But there's also what we call minor antigens that we don't always type for, and presumably some patients can develop antibodies against the red blood cell unit they were transfused, and over time this can make them more difficult to find matched blood for them. So these are just reasons we don't willy-nilly transfuse red blood cells. So we also, sometimes we use cutoffs. We say, okay, well, the hemoglobin should be less than 7 for certain types of patients. But on the other hand, if someone is having a cardiovascular event, they're having angina or ischemic heart disease, acutely, they may need more red blood cells than the cutoff of 7 would dictate so they can deliver more oxygen to their heart. Uh, so there's a lot of considerations. It's really not a snap judgment or a simple yes or no. I think all clinicians put a lot of thought into this and certainly work closely with our colleagues in transfusion medicine to help establish the need. And of course, the need, we look at this even more rigorously in the setting of a red blood cell shortage. When we try to, as much as possible, save the red blood cells for the people who really, really need them the most. Well, I think that hematologists need to understand the seriousness of this particular event. This is something that the Red Cross has only issued this dire warning once before, which was in the midst of the COVID pandemic. But you know, characteristically, the summers are the most difficult time when blood shortages become more acute, and that's probably to some extent due to the fact that more people are out doing things. There's more trauma in the summer. Surgery continues as it always continues, but not only is there more need, but there's fewer donations because people are on vacation, they're doing other things. I don't know why it's really so severe this summer, but obviously we've had some just life-threatening heat domes throughout the country. People don't want to go out, leave their safe air-conditioned sites. We've had fires in the West, smoke. So there's been a lot of, and I think flooding in the Midwest. So there's been a lot of reasons why probably people are donating less. But characteristically, the need for blood goes up 10 to 30% in the summer. That's the need, and the amount of donations falls 10 to 20% in the summer. So I think this summer is just particularly bad. It's sort of the perfect storm for both of those. So my message would be to clinicians, use blood sparingly. To patients in general and the lay public, it would be to please donate if you're able. Please donate to the Red Cross. There's people's lives who depend on your blood. I think the Red Cross is offering some additional incentives to donations in terms of gift cards and so forth. So if you're a regular donor, please keep it up. If you're not, please consider it. It's essentially painless, and it's a really nice thing you can do to your fellow citizens.